This is a reading of Written in Bone, Buried Lives in Jamestown by Sally Walker, Chapter 7, Part 2. On page 92, you'll see a picture, and its caption says, "This image, greatly enlarged, shows the texture of the ribbon that had been wrapped around the lead coffin lady's wrists." And on page 93, the picture's caption says, "The second lead coffin, which you see above, contained the remains of a grown woman. Her skull was still covered in hair." In the picture in the above right, Owsley and his colleagues, Tin Riordan, studied the way the body was treated before burial. And you'll see that picture on the right. And this text is called The Lady of the Manor. The remains in the second lead coffin told the story of a much longer life. The coffin, although better made than the baby's, wasn't perfect. Small nicks in the lead sheeting were caused by errors in cutting. The addition of a small lead extension strip showed that the coffin maker was inexperienced at making lead coffins. That's not surprising, since they were uncommon. The body, however, fit perfectly in the narrow inner coffin made of yellow pine, an indication that the occupant had been slender. The wood coffin lid had cracked and collapsed into the skeleton, damaging several bones in the pelvis. Traces of dry tissue still clung to the individual's bones, and a fair amount of time the brown hair covered the skull. Some of the vertebrae showed signs of arthritis. From dental and bone clues, Owsley and Brewelhide concluded that the remains belonged to a slender woman about 5'3" tall, 1.6 meter, who had lived to be at least 60 years old. 3 discoveries confirmed that the women who prepared this body for burial had treated it with great respect. Remnant strands of linen were still wrapped around some corroded green pins, proving that she had been shrouded. The other 2 pieces of evidence were far more unusual. A silk ribbon tied neatly in a bow around the lady's wrists held her hands in place across her waist, and sprigs of rosemary, a strong-smelling herb, were strewn over her body. Rosemary was an herb the English used for remembrance, explained Henry Miller, noting that this custom is mentioned by the character of Ophelia in William Shakespeare's famous play Hamlet, written in about 1599. Traditionally, Europeans and the English placed cuttings of rosemary at weddings and funerals as a reminder to keep people in one's memories. Seeing this ritual continue on this side of the Atlantic shows how the colonists were trying to follow English tradition, Miller added. As Owsley and Brewelhide studied the woman's bones, they noticed that many had lost mass and become thin. Thinned bones like these are a sign of a condition called osteoporosis, which results from a lack of calcium in the diet. The bones of people with osteoporosis become brittle and break easily. Much of the time during the last years of her life, she was in a lot of pain, said Owsley, and she walked with a limp. A quick glance at the lady's right femur was all Owsley needed to make these deductions. The shaft in the bone was enlarged and badly deformed. Several years before she died, she fractured her femur. He explained. When the bone broke, the lower half of the bone twisted and shifted upward. The pain would have been agonizing. When a person breaks a leg bone in this way in modern times, a surgeon realigns the bone correctly and braces it with a metal plate, which is fastened to the bones with screws. A system of cables and pulleys known as traction may be used to maintain the leg in an elevated, immobile position for a short time as the bone begins to heal. In colonial times, the best that could have been done was to hold the leg in place with a wood splint while the patient rested in bed for several weeks. In the case of the lead coffin lady, new bone had grown in her femur at the area of the break, fusing the two broken pieces together. That's how Owsley could tell that she had broken the bone several years before her death. Bone measurements confirmed what was easily visible. Her right leg was about 1 inch, 2.5 centimeters shorter than the left, more than enough difference to cause a limp. An irregular bony growth on the femur near the area of the fracture told Owsley that the broken bone was also plagued with an ongoing infection that occasionally flared up, causing the lady additional pain. On page 94, it shows in the picture, the caption tells us that these cross sections show that the bones of the lead coffin woman on the right were far thinner and more fragile than those of the person in the largest lead coffin on the left. On page 95, the picture shows us the lead coffin woman's leg bones showed that she had broken her upper leg bone and that it had not healed well. Because of the break, her legs were different lengths, and she likely had a painful limp. The large hole detailed in the right side of the picture is due to an ongoing infection in the bone that occurred even after the fracture had mended. Pus would have drained from the infection through the smaller holes above. But the leg wasn't her only problem. She'd lost 20 teeth by the time of her death. Many of her 9 remaining teeth had decayed. Others were worn down to the gum line. The positions of the remaining teeth were such that when she chewed, none of them would have closed together. Furthermore, the roots of these teeth barely held them in place, so it's likely that she could only eat very soft foods. Despite these problems, Owsley did find evidence that the woman had tried to take care of her teeth, or at least to make them look better. Her lower teeth, even below the gum line, were marred by deep hollow that Owsley recognized as evidence of a common method of tooth cleaning. Practitioners wrapped a cloth around the finger, dipped it into a gritty paste, and scrubbed the cloth across the surface of the teeth. Unfortunately, the colonial formula for tooth polish was a recipe for disaster. The ingredients in the paste were vinegar, salt, and tobacco ashes, which contained microscopic particles of an element called silicon. Though the intent was to make the teeth appear sparkling white, the salt grains, the gritty silicone particles, and the acidic vinegar actually wore away the enamel of a person's tooth. Over time, the scrubbing created a visible, worn area across the teeth. Sometimes this furrow was deep enough to expose the pulp. This treatment undoubtedly contributed to the lead coffin lady's tooth loss. Had she lived a few years longer, all of her teeth would have fallen out. In her final years, the lady would have been malnourished because she was unable to eat a variety of healthy foods. It is likely that she was often inactive and at times bedridden due to the chronic infection and pain in her leg. As if the suffering from these ailments wasn't enough, laboratory tests reveal something even more disturbing. So on page 96, you'll see there's a picture, and the caption says, "The lead lady coffin only had 9 teeth left when she died." And on page 97, the picture's caption showed, "A reenactor above demonstrates how some colonialists brush their teeth. Note the furrow across the full set of fairly healthy teeth In the above right picture, caused by brushing, the lead lady's coffin teeth at the right have the same kind of furrow.